Oral health is that state of health that the mouth and all the associated structures like the tongue, the lips, the gum, the tonsils, even the floor of the mouth, the mucosa. Generally, all associated structures are in good condition such that you can perform the function uh, with your mouth or the functions required of your mouth without any stress or inhibition. So that ideal state of health of the oral environment where you can perform the required functions like chewing, talking, kissing, laughing, any function you are meant to carry out with your mouth when it is done without inhibition, that represents an ideal state of oral health. So it's very important that every human being considers the mouth as priority and take care of it.
Now, how would you how would you rate the attitude of Nigerians as regards their oral health care?
Well, there are a lot of factors that may be responsible to what I would call the very poor attitude of Nigerians to issues concerning oral health. You know, you can't blame people. There are a lot of competing demands. People have not even had enough to eat, to do the basic things, then they are even contemplating oral health issues. And you know, the thing about oral health conditions, they start very slowly. They may not hit the patient hard immediately. Like for instance, if what we call tooth decay, that dental caries, could start as a small discoloration. We call it white spots. You can see an area, a portion on your enamel that's the attack of the tooth. There's a spot, and that spot you saw there is a product of demineralization, the loss of mineral that strengthens the enamel as a result of acids in the mouth. That spot, if left unchecked, will progress to cavitation, and it will take an average of about 3 years, if not more, for that cavity from that spot lesion level to get to frank cavitation into the dentin. So you can see the time it takes. So patients may not consider it a priority because they have limited resources and they have huge demands in terms of their daily need. So people generally have poor attitude to health. I'm not holding brief for anybody who does that, but that is why we are doing this. That people should be aware that you don't have to wait for your conditions to get to that chronic stage, or life-threatening stage before you take care of it. You understand? Generally, the attitude of Nigerians are very poor to oral health issues. Some of them resort to self-medication. They do all manner of unthinkable things, all in a bid to get relief from oral health, not knowing that they are even causing more damage or harm to themselves by such harmful practices.
So what are some of the common oral problems that will come down with or the present with at the hospital?
The commonest one, if you ask me, is tooth decay, which we call dental caries. I think it is said to be the commonest disease afflicting man. The next one is gum disease, and in gum disease there are two legs of it. The initial stage is called gingivitis. It can progress to periodontitis, and then you can have things like halitosis, which we refer to as mouth odor. There are oral ulcers. You have cancers. You even have cystic formation. There are several conditions that affect human beings. There are even some other oral medicine conditions like xerostomia. There is even this loss of taste and smell, and other related conditions really that could afflict one in the mouth. So many. There are so many. Oral cancers are there, and the commonest when you talk about the oral environment is called squamous cell carcinoma. And it has the same, if not similar, predisposing factor like other cancers in the body: smoking, alcohol, and the likes.
So for general care of the mouth, what would you advise people to do to care for their mouth?
Um, well, if you to care for the mouth, you start by identifying what the problems are. Because if you, like we talked about tooth decay, for instance, you need to know what are those factors that are responsible for the initiation of that decay process. When you are aware of these causes, then it becomes easy for you to take care of them. You have to brush morning and the last thing before you go to bed. And then not just brushing, you have to brush using the right technique, using the right strength of toothbrush. We're good at use your medium or soft. And then you have to brush within the right duration. And then your toothbrush you have to change at least on the average after about 3 months on when the bristles begin to fray. So those are, once you do that, you've taken care of another aspect in reducing the bacteria load in your mouth. And then there's also this professional cleaning, which is called scaling and polishing, that we encourage people to do. It's very important that you do that because they are very difficult or hard to reach areas in your mouth that your toothbrush cannot get to. That way, in the clinic, a dental professional, referred to as therapist, can help you professionally clean those difficult to reach areas and remove or at least reduce the load of bacteria in your mouth. They will encourage, apart from brushing, you should use dental floss. It's very important that you floss in between your teeth too. Understand? So that again will help.
Now, what can government do to improve access to oral health care?
Awareness is still very poor. Government should encourage the dental profession by ensuring that the oral health policy that was passed some years ago is fully implemented, so that every nook and cranny of this country will have a dental facility. We'll have about 774 local governments, I'm sure. There's nothing wrong in government having a standard dental facility in all the council areas to ensure that people access dental care. And then there's also an aspect of dentistry that common among pregnant women. There are diseases that are associated with pregnancy. They that come for antenatal care can also benefit from dental care, even at that local level. So government should invest massively to take deliberate steps to improve oral health awareness. There could also be tax rebates or complete exemption for dental materials because they are very expensive. A lot of them are imported, you know. So build more dental facilities, create awareness, sponsor programs, partner with the association of professionals in that area so that awareness can be created. A lot of people, you know, even some who have the means to access health care, oral care, don't even know what to do. A lot of men are aware. You see big directors. I've gone to places when I see big people and I look into their mouth, I'm like, this person, money is not your problem. But they don't know what to do. Not many people are aware that they need to even go to the dentist to go and do scaling and polishing, which is washing of the teeth. So a lot of people are just, their problem is ignorance. So government should rev up advocacy. Let there be enough enlightenment for people. Let those at the helm of affairs, the policymakers, show some interest in dentistry and oral health so that people will be aware, improve infrastructure, check, lack of knowledge, poverty is there. Maybe you should just work on improving the pockets of Nigerians by paying more. I hear they're demonstrating for minimum wage. You want to tell those ones to come and do oral health procedure, and it's very expensive. Then the insurance, this NHIS insurance scheme should incorporate dentistry, as a primary care provider. That way people can access it, and then it will go a long way in helping people to enjoy better health. So there's nothing like complete, total, perfect health of the body if you don't consider oral health a priority. Then the insurance, this NHIS insurance scheme should incorporate dentistry, as a primary care provider. That way people can access it, and then it will go a long way in helping people to enjoy better health.
Thank you very much for coming on the show. We appreciate you.